The following cardio-oncology spotlight was recorded at the American College of Cardiology meeting 2025. The meeting title was Advancing the Cardiovascular Care of the Oncology Patient. And there we had a chance to sit down with some of our colleagues who were speaking at the meeting about their individual sessions. We know you're going to enjoy these short but meaningful segments. Thanks for joining us. This is Steve Caselli. I'm at the American College of Cardiology meeting in Washington, D.C., and I'm here with the president of ICOS, Dr. Susan Dent, and our former president, Dr. Teresa López-Fernández, current president of the ESC Council on Cardio-Oncology. So congratulations.
Thank you, Steve.
Always good to be with you. And Teresa's speaking at the meeting this week on risk stratification. So Susan?
Great. Thank you. And thank you for joining us for a few minutes to talk about risk stratification. So this is becoming a very important aspect of what we're trying to achieve in cardio-oncology. Can you speak to us a little bit about what is your data-driven approach to risk stratification versus me going into the clinic and just sort of saying, I think this patient is high risk? How do you define your data-driven approach to risk stratification?
Yeah, thank you, Susan. This is a very important question because I think that if we go for a more structured cardio-oncology, cardiovascular risk stratification approach, we minimize the risk of considering key aspects that can change the way we manage patients. So, of course, we are all aware that patients with cardiovascular problems, cardiovascular diseases, a past history of heart failure or a past history of an MI, are those at higher risk. But in general, when a patient has a new diagnosis of cancer, at least this is my perspective, sometimes we forgot to consider the impact of uncontrolled cardiovascular risk factors.
Mm. And the non-modifiable risk factors, right?
Exactly, exactly. And we know, for example, that patients with uncontrolled blood pressure are those who have the higher risk of developing arrhythmias or heart failure. So to be sure that we have a process or a score where we really need to say yes or no to the different cardiovascular risk factors and to score how important are these factors for a specific treatment that the patient is going to receive makes our life easier.
So thinking along those same lines, what are some of the key data points or parameters that you think are crucial that should be included in developing risk stratification tools?
Of course, we speak about cardiovascular diseases and main cardiovascular risk factors. What we probably miss now in the HFA ICOS score, for example, that we have is social determinants of health. And of course, the genetics. So you as oncologists are so precise in assessing how different cancer types and cells work. And you are so precise in the treatment. And from the cardiovascular perspective, we are still more mechanistic. So it's yes or not.
It's very interesting that you mention that because at least in the oncology world, we do a lot of what's called next generation sequencing, where we look for mutations in the cancers, and that helps us define the next treatment. Do you think there'd ever be a day where we could come and look at these jointly to say if those mutations also confer an increased risk, for example, of cardiovascular toxicity?
So hopefully, yes. Honestly, I don't know if this is going to become or not a reality, but we all have experience with young patients who develop unexpected dilated cardiomyopathy after even low dose of anthracycline.
Exactly.
And then when they have the problem, we assess a TT mutation or a laminin mutation. Mm-hmm. So for patients with past family history of cardiomyopathies, why not to include these genes in the general oncology panel? So I assume that this is because we do not think about, but not because this is impossible.
Yeah, I think that's so important because I know as an oncologist and my colleagues will often say, this is a young patient, they should be fine, they're not at risk. And then you give them a few cycles of anthracycline and they end up in heart failure and you don't understand why. But then when you go back and start looking at family history and other risk factors, so I think we have to be more open to considering every single patient we treat has a certain degree of risk. But the question is, how do we quantify that risk? So, low versus medium and high. And I know you spoke about that at your session today. So along those lines, if we do have risk prediction tools that have been developed, by the ESC and ICOS and other organizations. What are some of the challenges that you see healthcare providers face in terms of implementing and adopting these sort of risk stratification tools? Tough question.
Yeah, exactly. So the main challenge is to convince oncologists and hematologists to use these tools, because now most of the tools are published in the ESC ICOS guidelines, and we have just a few oncologists on board, honestly. And patients are at the oncology side or the hematology side. So we really need to invest on educational activities that bring this tool to the oncology space, and probably with that we can also refine these tools and to become these tools more easier for daily practice. They are quite easy to implement.
They are.
The ICOS score with an app is very easy to, you can invest just 1 minute or even less to do that. But oncologists and hematologists need to be convinced that this risk stratification score is important.
Yeah, no, you raise a good point. And I think the tools that do exist are easy. You're right. They are available as an app. It only takes a minute to actually do the score. But from my perspective, I think one way where we could help oncologists is building it into the treatment plan. So most of us use electronic medical records, and our chemotherapy plans are in that record. And on there, they have all the different things you have to measure prior to starting the cancer treatment. And certainly I see, some of the tools could be incorporated into that so that have to be completed before you sign off on your cancer therapy. Now, it can be done, but as you raised, the question is convincing oncologists and hematologists that this is an important thing to do. And I think that's going to, as you noted, it's just going to take some more time and education. I also, hope that as we move forward in terms of risk stratification tools, that, as you alluded to previously, that we can really work to refine them and to ensure that they really provide an individualized risk stratification. And I think we have to move away from that idea that, if they're young, they're fine. If they're old, they're not. Very simplistic, that we have to look at better ways to refine risk stratification. Because if we don't, then how do we know who, is at risk? How do we know who we can try and reduce their overall risk? Right.
Another important point is that we are also afraid about older people with many cardiovascular risk factors. But when cardiovascular risk factors are well treated, they do not develop cardiotoxicity.
That's a very good point. Well, thank you very much for joining us today. Do you have any last comments that you would like to make before we let you get back to the meeting?
Oh, no, thank you for having me first. And I think that probably the right way to move forward is to keep our collaboration between the ESC Council and ICOS stronger than ever, because we really need to have this collaboration to create this awareness on how important is, in this case, risk stratification, but of course, cardio-oncology study.
Yeah, and I'll add to that even, I think, including all of our healthcare provider partners, such as our nurses, our APPs, our nurse practitioners, and the whole healthcare team. Because as you mentioned earlier, it can't be just, cardiologists, oncologists, hematologists. We need to make sure all of the healthcare team are on board and working to improve really the cardiovascular health of our patients. So thank you.
Thank you, Susan.
Yeah. For more information about ICOS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.